Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about golfer's elbow. So golfer's elbow is another name for medial epicondylitis. It is something that you can get playing golf, but you can also get it through many other ways. So it's not limited to just golfers. I think that's one of the main things people say to me. If I tell them they have this golfer's elbow, they say, I don't play golf. It's just a nickname for the injury or what we diagnose you with. It doesn't mean you have to play golf. So it's just very common in golfers. But again, the other side is called tennis elbow. You can get tennis elbow, you can get golfer's elbow, even if you've never picked up a club, if you've never picked up a racket. So just be careful of some of these wider known terms for these diagnoses. They may concern you, they may not, but don't think you don't have golfer's elbow because you've never picked up a club before. You can do it, you can have it. So golfer's elbow is on the inside of your elbow, all right? It's very specific. It's generally, you actually can have literally a point where you're like, that's where the pain is coming from. That's what hurts. And that's where the pain is. This is where all of these muscles are going to come up and attach. So many times it's going to be one specific point. Often it can come into like everything here is sore. It depends on how long you've honestly been ignoring it, but you can get that pain where all of this on the inside of your elbow is sore. If it's up here, that has nothing to do with golfer's elbow. It's on the outside, nothing to do with golfer's elbow or medial epicondylitis. This is very, very specific to the inside. Okay, so when you are thinking that you have this, there are a couple things that you can do. First of all, you want to ice it. Okay, icing is going to help this tremendously. Freezing a water bottle, putting that on there, or taking a styrofoam cup or a plastic cup that you can fill with water and then rip off the top, so you can kind of do an ice bath and a very specific ice massage right here. That's very beneficial. This is coming from all of these muscles. So you want to watch your grip, okay? If you're gripping something very intensely, it can cause this to get much, much worse. So while you're treating this, you do want to be careful of how hard you are gripping things, how hard you are using, if it's your dominant hand, using it to sign or to write. Just watching all of the things that you're doing with your hand, because all of that comes up into here. If you are a golfer, backing off how hard you're swinging your clubs, maybe playing with your shorter irons, just to give this a little bit of a break can certainly help. You can also do a couple stretches. You can stretch your arm, okay, straight out like this, and then just pull back. Nice and easy. You can also flip your hand just to get the other side. You want to hold this about 30 seconds. Okay, and then you want to do a count of 6. This is the more beneficial stretch for the inside of the elbow, but if you want to get both sides, you can do this. And then there's the stretch where you can put your palms flat on a table or on a surface. Keep your palms flat and then lean backwards. Okay, you should feel a stretch right in through that elbow. If you don't, then don't try and force yourself to lean way back. Just lean back, and if you feel a stretch in through here, that is a good sign that you are going to be able to stretch that muscle. Besides stretching, you do want to strengthen. This is a sign of weaker muscles. It's a tendinitis. It's an inflammation of a group of tendons, meaning something in your arm is working harder. This is working harder than something else should. Generally, that's your rotator cuff. But you do want to get diagnosed to make sure that's the specific muscle that's failing, causing this to work harder. So it is important that many people just like to address it, get the pain to go away, take a leave, take Advil, and be done with it. And this can come back much worse. And if you do not address why it actually happened, which again is most often weakness somewhere else in your shoulder or in your arm that needs to be addressed. This needs to be calmed down, and everything else needs to be strengthened. If you or someone you know is suffering with elbow pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.